Jolanda Cibere, one of the senior scientists at ARC, the Arthritis Research Centre of Canada. Now, Jolanda has been recognized by her peers with so many prestigious awards, I'm not even going to begin to name them. I'm just going to let you know that she is a rheumatologist specializing in osteoarthritis as well as osteoarthritis research. She's an associate professor in the Division of Rheumatology, you say that, Department of Medicine at the University of British Columbia. Please welcome Jolanda Cibere. Dr. Jolanda Cibere.
Thanks, Celine. Good morning. It's wonderful to be here. Thanks for this kind introduction. I am going to tell you about the latest treatment guidelines for osteoarthritis. Let me see if I can make this work this time. These are developed by the American College of Rheumatology, and they're usually updated regularly, and most recently they were updated and published again in 2012. The guidelines are based on a comprehensive review of the literature, all the studies that are out there, and it includes an evaluation of the evidence, so it includes an evaluation of the quality of the studies. And in these guidelines, they include drug and non-drug related treatments, and they include recommendations for hand, hip, and knee osteoarthritis. Although I won't tell you a lot about the hip osteoarthritis because the guidelines are actually very similar to knee. So I'm going to talk about hand and knee osteoarthritis guidelines and what the recommendations are for that. When the committee came up with these guidelines, they had choices for recommendations. They could either strongly recommend a treatment to be used or conditionally recommend a treatment to be used if there was less evidence, or they might make no recommendation if there was no evidence, or they could also conditionally or strongly recommend not to use a treatment if it was shown not to work. And the strength of the recommendation reflects not only the quality of the evidence, but also the extent to which benefits of treatment outweigh the risk of treatment. So they took into account the possible risks and harms of a treatment when they made their recommendations, which is actually a good thing. So let me start with hand osteoarthritis, which typically affects the finger joints, as Pam mentioned, and sometimes the base of the thumb. Let's give you an example of a case that the committee considered when they made the guideline recommendations. So this is a patient with pain in the finger joints who has tried acetaminophen 3 grams per day with no relief of pain. Now that's the equivalent of Tylenol extra strength, 2 tablets taken 3 times a day, which is a good dose. So as you notice, Tylenol or acetaminophen is the first-line treatment for osteoarthritis. When you have no response to that, what are the recommendations? So here's a table that shows the various recommendations and the strength of recommendations. So at the top here, and here's all the list of recommendations. And as you can see, none of them were strongly recommended. They were all conditionally recommended. So first, the patient should be evaluated for his or her ability to perform daily activities, and this usually should be done by a health professional, such as a physiotherapist or occupational therapist or the GP. And then treatment options include application of heat, joint protection, or assistive devices, and usually the occupational therapist will help with those kinds of decisions, or thumb splinting for patients who have involvement of the base of the thumb. And medication treatments can include capsaicin cream, which is a cream you apply to the joint. It kind of burns, and that's because the ingredient comes from chili peppers. Or you could apply anti-inflammatory creams, or take anti-inflammatory medications by mouth, or tramadol. Tramadol is a medication that works for moderate to severe pain, and it actually has an effect on the receptors in the brain, so it reduces pain centrally in the brain. Those are all conditionally recommended. And then the committee conditionally recommended not to use injections into the joints or opioid medications. Opioid medications includes drugs like codeine or morphine. So let me move on to knee osteoarthritis. Let me give you an example of a patient, a 59-year-old woman with ongoing knee pain who is generally healthy, presents to her family doctor. Generally healthy means in this case she has no heart disease, no history of stomach ulcers, and no kidney disease. And that's important to keep in mind because of some of the recommendations. She has not had a response to the occasional use of over-the-counter acetaminophen, anti-inflammatories, and nutritional supplements. So that's the case that the committee considered. So what can be done for this case, and what would the committee recommend? So guidelines state and strongly recommend exercise. So this can be either cardiovascular and/or resistance land-based exercises or water exercises. And there's no preference which one you choose. It depends on what you prefer. They both work equally well. Why do we want to do exercises? Well, it's because we want to strengthen the muscles, the thigh muscles, the quadriceps in the front of the thigh, and the hamstrings in the back of your thigh. Those are the muscles you need to strengthen. Why? Because strong thigh muscles reduce pain in the knee. We know that from research. And there's another reason why we want to do muscle strengthening exercises. And that's something we have shown in our research at the Arthritis Research Center, in my study actually. We followed 163 subjects with knee pain over 3 years, and we showed that the patients who had weak thigh muscles had a 5-fold increased risk of progression or worsening of osteoarthritis compared to the patients who had strong thigh muscles. So strong thigh muscles not only reduces pain in the knee, but it may also slow down the disease. Back to the guidelines. The other recommendation that was a strong recommendation is to lose weight if the patient is overweight. And weight loss is best achieved through a combination of exercise and dietary intervention. And what I should mention also is that the exercise usually should be supervised by a physiotherapist so that you're doing the correct kinds of exercises. And for weight loss, the same thing. And if you're needing dietary intervention, then perhaps consultation with a dietitian or nutritionist is helpful. Other options for non-drug related treatments are listed here. The rest is all conditionally recommended. So that could include self-management program, which is a program, an educational program that teaches you about arthritis, osteoarthritis, and teaches you coping skills, etc. Or you could use manual therapy, but only if it's combined with a supervised exercise program, supervised by a physiotherapist. Manual therapy includes massage therapy and other manipulation of muscle tissues, and sometimes manipulation of joint tissues, depending on which health practitioner you see. Or it could include psychosocial interventions, walking aids if needed, or application of heat. Other non-drug related treatments, some of these are knee-specific, include taping of the kneecap or wedged insoles. And again, the physiotherapist or occupational therapist would be able to help you with those kinds of treatments and help you decide if they're useful for your specific circumstances, because it depends on which part of the knee is involved. And Tai Chi is also conditionally recommended. The committee had no recommendation for balance exercises, manual therapy alone, or use of a knee brace. The drug-related treatments that they recommended for this case, and these are all conditionally recommended, are acetaminophen, anti-inflammatory medications by mouth or creams, tramadol, or knee injection with cortisone. The committee conditionally recommended not to use chondroitin sulfate, glucosamine, or capsaicin cream. Patient, I know you're going to ask questions about that. I'll wait till the question period. Yeah. Let's get back to the patient. So she's doing the exercises. She lost 3 kilograms of weight. She has been using acetaminophen at full dosage, 4 grams per day, and despite that, she has not had adequate pain relief. Now, what are the guidelines recommending? What's the next step? So now the guidelines recommend strongly that you should consider use of an anti-inflammatory medication. So this includes things like ibuprofen or Advil or Aleve, or many of the prescription anti-inflammatories that are available. or use as anti-inflammatory cream, or knee injection with cortisone, or a combination of the above. And conditionally recommended, again, was tramadol and duloxetine. Duloxetine is actually an antidepressant, but it has also been approved for treatment of painful conditions such as fibromyalgia. And conditionally recommended also knee injection with hyaluronate or viscosupplementation. What if the patient has not had an adequate response to all of these non-drug and drug-related treatment modalities that I've discussed? This is the point where you might consider surgery if there's moderate to severe pain. But what if the patient, What if the patient is unable to have knee replacement surgery? What is the next option that you would consider? So the guidelines then state, now strongly consider opioid medications. So again, that includes codeine or morphine. Or conditionally try duloxetine. And in this case, perhaps you could try things like traditional Chinese acupuncture or transcutaneous electrical stimulation, which is something the patient can be taught, which is something, a machine you apply on the skin. So really, if surgery is not an option, you sometimes have to use these other treatment options. So those are the guidelines. Let me summarize some of the key points that I want you to remember. Always, always, always consider non-drug-related treatments for the management of osteoarthritis. There's many options out there, and so do consult with your physiotherapist, occupational therapist, or dietitian for these various treatment options. Acetaminophen is recommended as the first-line treatment for all hand, knee, or hip, or any other osteoarthritis. And I would emphasize, you want to make sure that you're using an appropriate dose. If you're using acetaminophen once in a while, or if you're using it regularly but at a low dose, it's just not going to help, or not help sufficiently. The anti-inflammatories are recommended as a second-line treatment, and this is the treatment option you would want to discuss with your family doctor to ensure that it's safe to use. And that's because there are some side effects that you want to consider and be aware of when you're using these kinds of medications. And finally, keep in mind that there are other drug treatments available and there's new developments coming along, so there may be new options in the future. And consider injections, both for knee and hip arthritis, or surgery if you have inadequate improvement. And with that, I will close and would be happy to answer any questions. Thank you.